the connections between the individual teeth and the meridians passing through the mouth are so specific that when a patient comes in to me complaining of a particular problem, immediately I'll start to look for like these associations. An example, I had a lady come to me and she told me that she was having problems sleeping. And her chiropractor told her, well, this is related to your gallbladder and your liver. And he gave her all kinds of treatment with herbs and other things that would often work to help resolve problems in the gallbladder and the liver. But it turned out that she had a bite problem, and the teeth on the meridians associated with the gallbladder and the liver were getting overstimulated when she would bite her teeth together or grind her teeth at night. And that was what was disturbing the meridian of the liver. Another interesting case, and this was earlier in my exploration of the relationship between acupuncture and the body overall. A patient years ago came in, last tooth on the upper right was broken down. The tooth had root canal treatment, and because it was so sore to bite on at the time, the dentist ground it down so there was no bite on the tooth. She comes to me to put a crown on the tooth. So we make a temporary crown, take an impression, have her come back a few weeks later, and she goes, Dr. Lerner, you wouldn't believe this. Like day after you put that temporary crown on my tooth, the pain I had for 2 years in the heel of my foot went away. And she said, at first I thought it was a bizarre coincidence. That pain had been with me daily for 2 years, and all of a sudden it was gone. And she said, the temporary crown fell off the other day and I have the pain again in my foot. And so what's the association? And I examined her using a technique known as applied kinesiology, where I was using muscles in her body, testing reflexes to get feedback to find which areas of her mouth were being affected, and found the acupuncture pathway that ran through the jaw and then down the back of the head and neck, all the way down the back through the heel of the foot, was disturbed without any support on that tooth. And as soon as I put her temporary back on, it all went away. We replaced the temporary with a permanent crown, her problem disappeared. Now, over the years, we've seen many instances of this, and also know other practitioners around the world who report similar occurrence.